Hello everybody, and welcome to PathoLogic. Today we're going to be discussing the different zones of hepatic necrosis. The lobular structure of the liver gives it some unique properties when it comes to cellular damage. Depending on the cause of necrosis, different regions of the lobule may be affected. This produces distinct patterns that we can recognize histologically, and in some severe cases, we can even see these patterns grossly. As pathologists, the pattern of hepatic necrosis can help us narrow down our diagnoses. First, we will briefly recap the normal anatomy and function of the hepatic lobules. The liver is divided into roughly hexagonal structures that are made up of cords or strings of hepatocytes. Blood and bile flow past these hepatocytes as they move through the lobule. At the corners of the lobules, we may have a portal triad. This structure contains a branch of a hepatic artery, a portal vein, and a bile duct. At the center of the lobule, we have the hepatic vein, which is also called the central vein. Portal blood enters the liver through the portal veins in the portal triad. This vein contains the highly nutritious blood coming from the digestive tract. Blood enters the lobule and drains out of the hepatic veins in the center of the lobule, so this blood we consider to be flowing into the lobule. Oxygenated blood for the hepatocytes comes through the hepatic arteries, which are also in the portal triad. Similar to the portal blood, this blood enters the lobule and drains out of the hepatic vein, so it is also flowing into the lobule. Conversely, bile is produced by the hepatocytes during their normal metabolism. Bile flows the opposite way of the blood, going through canaliculi out into the bile duct that is within the portal triad. So bile flows out of the lobule. When we talk about the zones of the liver, we are describing the location of the hepatocytes based on their position within the lobule. There are three main zones. Zone 1 is the periportal zone, or the hepatocytes surrounding the portal triads. Zone 2 is midzonal. Finally, Zone 3 is the centrilobular zone, or the hepatocytes around the central hepatic vein. With that background, we can start talking about the major zones of necrosis. We will start with centrilobular necrosis. Centrilobular necrosis is the most common form of zonal necrosis in our domestic animal species. The main causes are hypoxia or metabolized toxins, but some viruses can also cause this pattern of necrosis. Hepatocytes rely heavily on arterial blood oxygen. However, that blood must pass by a lot of hepatocytes on its way to the hepatic vein. This results in depletion of oxygen concentration by the time that blood reaches the hepatic vein, which produces a concentration gradient of oxygen levels that the hepatocytes can be exposed to. In animals that are hypoxic, the starting concentration of that oxygenated blood is much lower. Therefore, by the time the blood reaches the centrilobular hepatocytes, oxygen will be almost completely depleted. This results in cell death, specifically targeting the centrilobular hepatocytes. Potential causes of hypoxia are numerous, but we might think about things like anemia, reducing the oxygen carrying capacity of the blood, inadequate ventilation under anesthesia, respiratory disease preventing oxygen exchange, or congenital heart defects like tetralogy of Fallot, which allows deoxygenated blood to enter the aorta. Metabolized toxins also cause centrilobular necrosis. This is because the hepatocytes near the hepatic vein have the highest levels of cytochrome P450, which is a major enzyme for processing drugs and other compounds. Some of those resulting metabolites may be toxic to the hepatocyte that metabolized that compound. Therefore, these metabolized toxins primarily affect hepatocytes around the central vein first, due to their higher levels of cytochrome P450. There are many metabolized hepatotoxins out there. Consider drug toxicoses like mebendazole, acetaminophen, phenobarbital, or chemotherapy medications like CCNU. Plants can also cause centrilobular necrosis if they contain pyrrolizidines or are contaminated by aflatoxins. Sago palm and cycad plants also can cause centrilobular necrosis after ingestion. You can sometimes see evidence of centrilobular necrosis grossly. This type of necrosis would produce collapsed, dark areas centrally where the necrosis is occurring. These areas are rimmed by a paler edge of intact hepatocytes. It is important to note that you should not describe this pattern as a nutmeg liver. Nutmeg liver only results from chronic passive congestion of the liver. Here's an image of nutmeg liver for comparison. In this condition, the prominent lobular pattern develops due to congestion and dilation of the central hepatic veins. There may also be some apoptosis of surrounding hepatocytes, but necrosis is actually uncommon in this condition. Because of the dilation of the hepatic veins, you often see a tree-like pattern that resembles the cut surface of a nutmeg, hence the name nutmeg liver. Next, we have midzonal necrosis. Midzonal necrosis is actually very rare. It has been reported in pigs and horses with aflatoxicosis and cats exposed to hexachlorophene. However, it is unlikely that you will come across midzonal necrosis in your veterinary travels. This leads us to periportal necrosis. Periportal necrosis is rarer than centrilobular necrosis, and it results from direct-acting hepatotoxins coming from the digestive tract that do not require metabolism by P450 to be toxic. Potential causes of periportal necrosis include ingestion of metals like iron, copper, or phosphorus, ingestion of acetic acid, and ingestion of some plant species. For example, periportal necrosis is associated with acute bovine liver disease in Australia, which occurs due to consumption of grasses like dog's tail grass. Grossly, we see the opposite pattern of centrilobular necrosis. So this type of necrosis results in dark areas peripherally, with paler centers representing the intact hepatocytes in the centrilobular areas. Finally, we have massive necrosis. Massive necrosis affects the entire hepatic lobule. This often results in the lobules collapsing completely, bringing their portal triads and hepatic veins closer together. Usually, massive necrosis heals through scarring due to inadequate cells available for regeneration of the liver. Most causes of massive necrosis are toxins. Consider things like xylitol ingestion in dogs, poisonous mushroom ingestion, blue-green algae, drug reactions, or acute aflatoxicosis. In pigs, there is a specific cause of massive necrosis called hepatosis dietetica. This disease occurs due to selenium or vitamin E deficiency. These compounds are potent antioxidants, so without their antioxidant activity, oxygen-free radicals accumulate in the liver. This results in necrosis affecting the entire lobule. Now just some final notes on hepatic necrosis. First off, these are not isolated patterns. You can have multiple patterns occurring at the same time. Other diseases can also produce similar gross lesions. This is usually through highlighting a particular zonal region. For example, this hamster has a zonal amyloidosis. This cow has fibrosis in the connective tissue surrounding the lobules, highlighting those zones and producing a lobular pattern. Lastly, extensive necrosis will ultimately end in cirrhosis. Cirrhosis is a combination of fibrosis or scarring of the necrotic areas, along with regenerative nodules that develop from intact areas of the liver to try and maintain liver function. By the time cirrhosis develops, it is often difficult to determine the underlying cause of the liver disease that ultimately caused that cirrhosis. Thank you for watching PathoLogic. If you enjoyed this video, remember to like, subscribe, and share with your classmates. It really does help the channel grow. Thanks again for watching, and we will see you in the next one.